Hello, here is our next teaching unit, Psychological Mental Skill Training. I'm Dagmara Budnik-Przypylska. I work at the University of Gdańsk and I'm sports psychologist. Here I'm going to tell you about theoretical framework concerning psychological skill training. At first, we should get the information, get the knowledge where mental skill training is situated. As you can see, we can have psychotherapy, counseling, and mental skill training. Psychotherapy is an intense process focused on helping clients deal with persistent and distressing life problems. Counseling is the work of helping people cope with everyday problems and opportunities. And mental skill training is an educational process that helps the client build particular skills in order to enhance performance. Here we have another definition. Mental training is a process in which athletes, usually with the help of consultants or coaches, systematically use strategies and techniques to build mental skills as well being to enhance their performance, development, and experiences in sport. Enhancing mental health in athletes is an important objective for mental performance consultants. As you can see, here is a framework for understanding mental training in sport by Wiley, and I'm going to explain each factor, each subject of this model. At first, we should start with consultant's philosophy. Consultant's philosophy and model of practice lead to the customized use of strategies and techniques. Here are some examples as holistic consulting philosophy and acceptance-based philosophies of practice and phenomenological consulting philosophy. Here are some models of practice and the optimum performance programs in sport, the mindfulness, acceptance, commitment, the will of excellence, etc. Strategies are described here. There are combinations or unique ways of presenting or teaching specific mental training techniques. Some examples of mental training strategies are centering, personal highlight reel, competition-focused plans, P3 thinking, etc. Techniques are the specific procedures or methods used in mental training. It could be imagery, self-talk, goal setting, relaxation, etc. The term mental skills training is often interchangeably used with psychological skill training. Skill is the ability to do something well or proficiency acquired through training and experience. Mental skills are learnable psychological capabilities that facilitate individual success in life pursuits. In sport, mental skills are invaluable in helping athletes optimize their well-being, performance, and development in a stressful, competitive environment. We have multiple types of mental skills. It could be personal foundation, performance, personal development, and team skills. Personal foundation skills provide a strong basis for success in sport. They provide a facilitative effect to set the athlete up with a strong and adaptive mental foundation to respond well in challenging situations, such as competition. They consist of motivational compelling, self-awareness ability, productive thinking managing, self-confidence belief, mindfulness, acceptance awareness, and self-compassion. Performance skills are critical to the execution of skills during sport performance. They consist of perceptual cognitive, attentional focus ability, and energy management ability. Personal development skills represent significant markers of maturation, self-development, and autonomy. They consist of identity achievement establishing, interpersonal competence ability, lifestyle management proactively, and leadership ability. Team skills enhance the culture and contribute to team success. They consist of communication process, psychological safety, shared cohesion, team's ability, and team confidence belief. Mental training interventions with athletes should help them build mental skills and mental health in the form of well-being or flourishing, high levels of mental health. Emotional well-being is about feeling happy and satisfied. Psychological well-being, one's functional ability to feel purpose in life, seek personal growth, master environmental demands, communicate effectively with others, and achieve autonomy and self-acceptance. Social well-being reflects one's sense of belonging to and support from others, contributing something of value to society, and acceptance of others. Here we are going to explain and introduce instrument and measures. This part was prepared by Marika Pacici. There's a huge interest in instrument targeting psychological skills and strategies in sport, as they are likely to differentiate more and less successful athletes and provide evidence regarding the efficacy of psychological skill training programs. Psychological assessment in sport identifies psychological factors that enhance successful performance. Several instruments have been created to measure personality constructs related to sports outcomes, general sport-related behavior, specific mental skills, or target specific disciplines. However, here we are going to discuss only a few of them. For deeper understanding of the instruments, please refer to the following book, Assessment in Applied Sport Psychology. Here are some examples of measures and instruments from the past. Psychological performance inventory assessed self-confidence, negative energy control, attention control, visualization and imagery control, motivation, positive energy, and attitude control. Next is the psychological performance inventory, A, and it assessed determination, self-belief, positive cognition, and visualization. Next, psychological skills inventory for sport. And next one, mental skill questionnaire. Here, there are examples of measures and instruments in actual use. Athletic coping skills inventory, which assess coping with adversity, peaking under pressure, goal setting, mental preparation, concentration, freedom from worry, confidence and achievement motivation, and coachability. TOPS, test of performance strategies, assess goal setting, relaxation, activation, imagery, self-talk, attention control, emotional control, and automaticity. Here we have other instruments, the DAVA mental skills assessment tool, which assesses foundation skills, somatic skills, cognitive skills. The sport mental training questionnaire measures foundational skills, performance skills, interpersonal skills, self-talk, and mental imagery. Here we have specific information about athletic coping skills inventory. This is the short version of 42 item measure, and this measure consists of 28 items and measure 7 factors, and they are following: coping with adversity, peaking under pressure, goal setting, mental preparation, concentration, freedom from worry, confidence and achievement motivation, coachability. Here we have some examples of following factors. For example, I maintain emotional control no matter how things are going for me. It's for coping with adversity. Peaking out under pressure. To me, pressure situations are challenges that I welcome. And for example, for goal setting, mental preparation, on a daily or weekly basis, I set very specific goals for myself that guide what I do. Next, for concentration, for example, I handle unexpected situation in my sport very well. Freedom from worry. While competing, I worry about making mistakes or failing to come through. For confidence and achievement motivation, I feel confident that I will play well. For coachability, if a coach criticizes or yells at me, I correct the mistake without getting upset about it. To some of the 7 subscales, provide the personal coping resources score. Limitation for that inventory, that it doesn't appear to provide a comprehensive assessment of psychological skills. Next is the test of performance strategies, TOPS. It was developed to assess psychological skills during practice and in competition, based on the psychological processes that could underlie successful athletic performance. The distinction between psychological skills and the methods, techniques used to develop those skills are sometimes and somehow controversial and difficult to determine. This test considers the most salient psychological skills and techniques together with their strategic use by athletes. Test of performance strategies TOPS consist of 7 factors: attentional control, goal setting, imagery, relaxation and activation, self-talk, emotional control, automaticity. The ratings was based on 5-point scale, And inventory items were divided into two subscales, one for competition and one for training. Here we have some items concerning each factor. For example, self-talk, talk positively to get the most out of competitions. For example, for emotional control, emotions keep me from performing my best. Automaticity, perform without consciously thinking about it. And for goal setting, set personal performance goals. Here we have some for imagery. Imagine competitive routine before I do it. For activation, increase energy to just the right level. Negative thinking, imagine screwing up. Relaxation, able to relax if I get too nervous. For goal setting, this is a practice strategy. For goal setting, set realistic but challenging goals. For emotional control, trouble controlling emotions when things are not going well. Automaticity, during practice sessions seem to be in a flow. And for example, for relaxation, practice a way to relax. For self-talk, talk positively to get the most out of practice. For imagery, when I visualize my performance, I imagine watching myself as if on a video replay. For attentional control, attention wanders while training. And for activation, trouble energizing if I feel sluggish. Here there are some examples of studies that use the TOPS. Here there are another. The new version of test of performance strategies, TOPS 2, consists of the 64 items scale. Changes have been made to the relaxation items for the practice subscale and the automaticity items for both the practice and competition domains. And the TOPS 2 provides an integrated test of psychological skills that might be used in conjunction with other methods to provide an overview of athletes' usage of a broad range of psychological skills. And here are some items, competitive items, and here are other, for example, for the imagery, rehearse performance in my mind. And for distractibility, visual distractions would affect my performance. Here are some items for the practice strategy. For example, for factor 1, self-talk, motivate myself to train through positive self-talk. And for example, for goal setting, very specific goals. For imagery, visualize successful past performances. Here we have another measure, the Ottawa Mental Skill Assessment Tool, OMSAT-1 tool. OMSAT-1 consists of 114 items scored on a 5-point Likert scale. And here are some components: foundation skill, psychosomatic skills, cognitive skills, competition skills, and team dynamics. Seems some items were unclear, included multiple questions and a lot of don't know options. The OMSAT 2 has been developed. This version consists of 12 mental skills scale. And the third version of Ottawa Mental Skill Assessment Tool was developed to overcome the limitation of the previous version. The OMSAT 3 consists of 7-point Likert scale, and it consists of 48 items and 12 subscales. The three factors are the following: foundation skills, psychosomatic skills, and cognitive skills. Here are some items. I set daily goals, for example. I lose my focus during important competitions. I find it easy to create mental images. Here another, for example, I'm afraid to lose. I have clear mental images. I find it easy to relax quickly. My mental practice is planned. My goals push me to work harder. I find it hard to gain control of things, to reduce my fears in training, etc. And these measures can serve a variety of purposes. It could be administered at the beginning and at the end of the mental skill training program to investigate its effect. Next, the Sport Mental Training Questionnaire has been developed as a tool that assesses some components in mental training. This questionnaire was convinced to be a short questionnaire addressing the most important and the robust components of psychological preparation, which are universal across sport discipline. It predicts real-life preparatory actions and sport performance outcomes. It consists of 40 items divided into 5 factors. The items were grouped into 2 conceptually different subscales, mental skills and mental techniques. For mental skills, there are foundation skills, performance skills, and interpersonal skills. And for mental technique, self-talk and mental imagery. Here are some items for specific subscales. For example, for foundation skills, I have an unshakable belief in my athletic ability. For interpersonal skills, I accept my role in the group and I see it clearly. For performance skills, when I'm under pressure during a competition, I'm able to relax physically and mentally so that I am really I'm ready to perform. And here are some items for self-talk. For example, I use self-talk to help myself overcome difficult times, or I talk to myself to regulate my own thoughts, emotions, and arousal. And for example, for mental imagery, I use mental imagery to control my own emotions, etc. And thank you.